Morton, thank you.
Thank you, Deputy Speaker. I rise to speak on the motion put forward by the member for Ryan about supporting BUSHKids. I note the member for Ryan is my next door neighbour, an inner-city electorate, but I also note the contribution from the member for Bendigo, Queenslander by birth, but representing the seat of Bendigo in Victoria, and also the contribution from the member for Throsby from regional New South Wales. Great to have people from the Labor Party supporting this motion. Sad to see that silence from the LNP from Queensland when it came to this great motion put forward by the member for Ryan. Now, obviously, with an inner-city electorate, I don't have as many BUSHKids, but I know that many of them receive services in my electorate, being an inner-city electorate with the PA hospital right across the road from the electorate of Moreton, but also QE2 Hospital and many other services that I'll touch on. Now, BUSHKids does a great service. Growing up in St George, I know that they don't do outreach programs to St George, but they're only just down the road in Warwick and Inglewood and Dalby, but servicing all of Queensland. If we take our minds back to 1935, when we had a slightly different Queensland, still a very decentralised state, the most decentralised state, but the difficulties of living in these far-flung areas when you have a child that needs medical attention. This was a problem that the Governor of Queensland at the time, Sir Leslie Orme Wilson, recognised, and he sought a solution. He could see that children with the increasingly complex medical needs would become a particular challenge in the bush. So Leslie Wilson, a former British soldier, Governor of Queensland from 1932 to 1946. So in 1935, at his request, a meeting was convened by the Labor Lord Mayor, Alfred Jones, for the purpose of commencing the BUSHKids program to provide intervention and prevention for medical conditions suffered by children living in remote areas. Initially, this program offered access to city medical and surgical services for children who live in the bush. They provided homes near the beach for the children to recuperate with their families. The first home opened in Scarborough, just north of Brisbane. Other homes were established in Yeppoon, Harvey Bay, Rose Bay and Townsville. Eventually, these homes progressed and became registered as hospitals, and the Red Cross provided travel for the children from their country towns. The service provided help even during the difficult years of World War II when society's resources were stressed. The polio epidemic provided even more challenges for the service, but despite all of the obstacles, the BUSHKids service has continued for 80 years. Currently, BUSHKids operate centres in Brisbane, Bundaberg, Dalby, Emerald, Inglewood, Mount Isa and Warwick. The current program aims to build the capacity of the local rural communities to be able to respond appropriately to children who are at risk. This might include children with poor health or even educational or social outcome concerns. So, growing up in Western Queensland, I understand that the challenges that come with children that live in isolated areas, and also having taught in Toowoomba and Babinda in North Queensland, I understand the challenges that come with having a very decentralised state. I understand the importance of early intervention for children in these communities to access health and educational professionals. Early intervention can make an enormous difference to children, so rather than having them moving in a direction that's going to create challenges down the track, if we can have early intervention and guidance and support for parents, they can save a stitch in time saves 9 later on. BUSHKids provides early intervention for allied health for children and families in rural communities who would not otherwise receive the medical or educational care that they need. The service provided to children through the BUSHKids program are delivered through a range of facilities across Queensland, and one such as disability services at Oxley is easy to access, as I said, particularly for those kids coming in from Warwick and from Inglewood and from Dalby and for all the points west. So I commend the member for Ryan for putting this motion to the House. I'm disappointed that the Liberal and National Party, her Liberal and National Party colleagues weren't around to support this. Too often, I think that they can take that support in the bush for granted, whereas we really need to make sure that with a decentralised state such as Queensland, with major centres, Townsville, Toowoomba, Rockhampton, Mackay, Mount Isa, etc. We need to focus on the resources that are there.
The time allocated for this debate has expired. The debate is